talk to you about an eye condition called keratoconus. Keratoconus is an irregular shaped cornea. If you think of the word kerato refers to the cornea and conus refers to cone. So the actual cornea takes on the shape of a cone. Now, how will you know that you have keratoconus? Well, most obvious process of how it gets discovered by either your optometrist or your ophthalmologist is you have a high amount of astigmatism in the eye. Now, astigmatism is when the eyeball is not completely spherical. If you think of half of a soccer ball, that's what your eye should look like, and then compare it with half of a rugby ball. So it's an irregular shaped cornea, and that's what where the word astigmatism comes from. Now, you get two types of astigmatism: regular and, as I mentioned, irregular. Regular is when it's just the same shape of the eye that is like a nice and uniform rugby ball. Irregular is when this side of the rugby ball is nice and regular, but this side is protruding. So the surface of your cornea is not regular. The optometrist will usually kind of complain that it's difficult to test your eyes and that we can't get you to 100% even with the best corrected glasses. And the reason for that is if you can imagine this is your cornea and you have glasses in front. The light hits your glasses and it goes through your cornea, but because the cornea is not regular, it doesn't go through your cornea in a uniform way. It still distorts a little bit because of the shape of your cornea. What we will do in order to confirm the diagnosis is there's certain signs the doctor can see with his slit lamp or microscope, and then we will advise you to do what we call a pentacam. Now, a pentacam is to measure the topography of your cornea. We want it to be nice and regular, but what if we see on your pentacam the bottom part is usually down and in the bottom part of your eye? It will be protruding. That's like a firm diagnosis that we can say, yes, you have keratoconus, or no, it's just you have a high amount of astigmatism, but it's regular. So, and then it will look like a butterfly, because you'll see the astigmatism, but it will be the same in each area. With keratoconus, the one side will be much more protruded than the other side. How can you correct your vision in a better way than by just wearing the best corrected pair of glasses? Because even with the best corrected pair of glasses, your vision, the quality of your vision will not be optimal. We need to kind of neutralize the shape of your eye, and that we can do with either a hard contact lens or a scleral contact lens. Now, I'm going to explain hard contact lens first. So now you've got this irregular shaped cornea, and you put a soft contact lens you put on, what happens? It just takes on the shape of your cornea, and you still sit with this same irregular shaped cornea. Now, if you take a hard contact lens, it kind of molds the cornea, so you are getting rid of that protrusion at the bottom. Your vision, your quality of vision is much clearer because we are eliminating the fact that the bottom part is more forward than the top part. Second is to do a scleral contact lens. That is, sclera refers to the white part of your eye. That means the actual edge of the lens rests on the white part of your eye, which is the sclera. And we feel that we need to again neutralize the shape of your cornea. So how we do it is, this is your irregular shaped cornea, this is the large scleral lens that we put on, but can you see there's gaps in between? So we need to fill those gaps. We fill it with a clear, like saline solution. You'll put the lens on a little lens injector, and the lens will look like this. We'll fill it with water, and you need to obviously be perpendicular to the lens, and you'll slowly take it in until it's in, and you'll see vision is much clearer because we've neutralized that irregular shape of the cornea.